work on myofascial release and ligamentous articular strain release. So first of all, I'm just gonna check the leg length, and after leg length check, I'm gonna even to confirm it with applied kinesiology. So first of all, check.
Sorry for the interruption, Dr. Mahesh.
When it's your duty to check whether a patient is lying down straight.
Dr. Mahesh, sorry for the interruption. Can you ask your helper to just rotate the camera for in a landscape mode?
Yeah, thank you.
Thank you.
So after balancing entire body, we're gonna just give a traction to bilateral lower limb, bend it, neutralize it completely. I'm gonna check here how is the heels are in position. Can you just get the camera closer? I'm just finding very slightly leg length discrepancy in right side, because if you can see in middle malleolus, my right side middle malleolus is lesser than left side middle malleolus. So that indicates right side pelvis is posterior inferior, and this side could be anterior posterior. And even as per Ackerman, even there is a 80% rule that suggests that so the sacrum rotates to opposite. So let me confirm these findings with applied kinesiology. So here two contact points. I check the leg length discrepancy. Right now I'm checking the PSIS and ischial tuberosity. First of all, what is applied kinesiology? So this is a confirmatory test completely. And here, by checking this applied kinesiology, I'm going to get the confirmation. So wherever I'm finding the weakness, that means that is a deformity. I'm just going to bend this leg. I'm going to ask my patient to, bend his leg, and I'm going to give resistance on this side. Can you bend this inside? Relax. Bend this inside. Okay. So first of all, I'm going to check for anterior superior. So I'm giving the pressure anterior superiorly. Can you bend it inside? Thank you. And at ischial tuberosity, I'm going to give pressure to posterior inferior. Can you bend? Relax. Okay. Again, I'm going to confirm it. Do it again. Okay. Do it again. Okay. So this is posterior inferior, confirm at right side. Still, I'm going to check it on left side also. By working on, can you bend it inside? Yes. Bend it inside. Yeah. This is again anterior superior. And again, I'm going to check for sacrum also. Is base anterior, base posterior? First of all, I'm just going to put in the sacrum in, that is called, I would say, nutrition and counter nutrition. Can you just bend it inside? Yes, weak. Can you bend it? Strong. This sacrum is base anterior, that means nutrition, I would say. And now I would like to check for position of sacrum, right side. Relax. Do it again. Yeah. So this is posterior to right side. I would like to say about whatever discrepancy I find it, generally we correct it with chiropractic. Since years we are doing it. But I found it personally, if I do only osteopathic release, I found it even discrepancy gets fine. But still, after that also I go for chiropractic alignment. Because with chiropractic alignment, we are getting a complete result. And as I mentioned, I follow with exercise completely to strengthening of alignment. So I would like to repeat again. Right side ilium is posterior inferior, left side anterior superior, sacrum is anterior, and because right now only focusing on lower limb, I checked only that's for lower limb. So I'm asking my patient lie on the back. So I would like to tell you again, it's just shortage of time, but still I'm going to cover each and every point as we discussed already in PPT, and we did now examination part. So let me give you a complete idea about we are going to cover lower limb only with two techniques, myofascial release and ligamentous activation strain. So I'm going to follow entire chain with the psoas, iliacus, and then IT band, TFL, quadriceps, adductors, hamstrings, popliteal, gastrocnemius, tibialis posterior, soleus, tibialis anterior, and plantar fascia. So why this? So we get the exact balancing. Like even patients with like orthopedic conditions and neurological conditions, I found differences only with osteopathy. But still, as I mentioned, I do combination of all these three as an advanced posture alignment. So let me start and let me show each and every point. First of all, as I mentioned about, we go for psoas and then iliacus. Psoas is, as I already mentioned in the PPT, these points are fixed. How? So in between the umbilicus and ASIS, center is for psoas, because your psoas muscle starts from T12 to L4. So this considered to be a belly. Yes. So here I'm going posteriorly. I'm maintaining the pressure posteriorly. I'm going to ask my patient to bend in right leg only. In, out 5 times. Now, please make sure your patient does entire range just for the better efficacy. Thank you. So now next point would be iliacus. The origin of iliacus everybody knows. It starts from iliac fossa and ends at the lesser trochanter. So next to uh, ASIs, you can dig the muscle iliacus. So again, by holding this, yes. So make sure again, go for entire range, in completely, out completely. Yes. Thank you. So this again helps in balancing. Some patients, they make it click while doing this. Okay. So after releasing psoas and iliacus, I'm just gonna work on IT band and then TFL. So here you have to maintain the pressure perpendicular to the bone and approximate each other. So maintain the pressure and approximate to each other. Again, repeat this 3 times and then go through course of IT band. So hold next point now. Press, approximate to each other. Press, approximate to each other. Again, approximate to each other. Okay. So by working this three, I'm asking my patient to turn to one side. To cover, down straight, leg bend. Thank you. So I'm going to cover now tensor fascial lata by placing the point exactly above to greater trochanter and hold this point, compress perpendicular to the bed and go proximal, release. So compress, go proximal, release. Again, compress, go proximal, release. Okay, I'm asking my patient to again come back, lie down straight. Okay. So why I'm following this sequence? Because there is kinetic chain is present all over body, and I would like to say through fascia it is well connected. So we have to follow this sequence only. If you want to find result, you have to follow this sequence only. First is psoas, iliacus, IT band, TFL, and then I have to ask my patient to relax, knee bend knee, and now I'm gonna go through course of quadricep from distal to proximal. Okay. So with your thumb pressure perpendicular to the bed and go proximal down, proximal down, proximal down. Next point, proximal down, proximal down. Third point, proximal down, proximal down. Yes. So here, after doing quadriceps, I'm going to work on adductors by pressing above tuberosity. I'm going to again proximal down, proximal down, proximal down. Your patient may find this painful because of inguinal region. I'm going to work up to inguinal region 3. So even this of my colleague is wincing. Okay, thank you. Thank you. So though it is painful, but we have to explain our patient. Now I'm going to work on hamstrings. So hamstrings we can work either in supine and prone also. But I would like to say to ease of patient, not to asking patient again to change the position. I love personally to work this way in supine. So you
Dr.
have to
Mahesh,
go from again distal to proximal, medially to laterally. First, I'm going to cover medially, uh, compress the muscle upward, and then proximal down, proximal down. Okay,
Dr. Mahesh,
compress. Huh?
am I audible?
Yes, tell me.
There is a question from Mansi Songirkar. She
Huh?
was asking of SOS iliacus TFL quads. Is there any exact chain? She's asking.
There is exact chain. So I would like to help after finishing this entire chains. So I will answer about the same.
Thank
It's fine with.
you. Yeah, it's fine.
Okay. Yeah. Thank you. So I'll not break the sequence. That's why. So the yes again yes again from now laterally I'm working lateral hamstrings is upward down yes okay now after releasing hamstrings I'm going to work on popliteal. So again for popliteal compartment I'm going to work from medially to laterally, and here also with my only middle finger I'm going to press it upward, and then proximal distal come to middle, proximal distal come to middle. And this is again going to be the painful part. Patient may complain while doing it, but don't worry, you continue. So upward, down, 1, 2, 3. Then intermediate, upward, proximal, distal, and come to normal. Again laterally. Explain hams again. Could you? Yeah, I can explain ham. Just 1 minute, please. Again, proximal, distal, relax. Okay, so as per somebody requested, I'm gonna working on hams again, medially to laterally, and distal to proximal. I'm just go in the course of distal to proximal. Again with my all fingers, because hamstring is big muscle, so I have to go upward and then proximal and normal. Here, don't go distally. Only proximal and normal. Proximal, normal. 3 times each. Proximal, yes. Again, proximal, yes. And lateral hamstring again. Proximal, yes. It may seem I'm going distal, but I'm not. I'm just pressing it upward. Proximal, normal, like that. I hope it's okay with you. Shall I
Yes,
continue ahead?
yes, go ahead, please.
Thank you. So after doing hamstring and popliteus, I'm going to go down for gastrocnemius, calf muscles. So again here, medial to laterally. For medial gastrocnemius, again same way. So, but now at this point, I'm going to go distally, not proximally. Here I'm going to go distally, normal, distal, normal, distal, normal. 1. Again, distal normal 2. So again, upward distal normal. But as per muscle structure, distal normal. Yes, distal normal. So by doing gastrocnemius, I'm gonna go down on tibialis posterior and posterior. So here would be the point. I'm gonna go upward and distal normal. Yes. I'm gonna work on tibialis anterior. Here again, I'm gonna use only 2 thumbs. So smaller muscle. Again, I'm going distal normal. Yes. Yes. So by acting this way, now only remaining is the foot. So I would like to ask my patient to keep the legs on that side. It will be easy for demonstration. So here I would like to tell, I could have finished on that side only, but I wanted to show you. That's why I asked my patient. It will be easy for me to show it to you. So first, work on dorsum aspect, then go for plantar aspect. So for dorsum aspect, you have to hold at tarso-metatarsal joint and compress downward. Okay, compress downward. Ask your patient to do dorsiflexion again and again. Do it. Yes, 1, 2, 3, 4, 5. Now we can come to relax the plantar fascia by holding again at the tarso-metatarsal area and the direction of thumb towards outside and towards toes. Ask your patient to do now plantar flexion. So it will, so with the maintenance of pressure, I can go upward. Come on. Yes. Keep moving forward. 1. Keep moving. 2, 3, 4, 5, 6, 7. Thank you. So like this, I have completed entire one leg. I would like to ask the patient again, lie down. So for safer side,
I think somebody unmuted the
I'm covering
documents coming.
Dr. Mahesh,
entire right leg, and this I'm not gonna go so in brief because we have limitation of time. Okay.
1 minute.
Anything?
Yeah, Dr. Mahesh, please. One.
बोलिए.
I will request all attendees to keep your mic off.
Please keep your mic off. It will be easy for us to demonstrate, and the processor will be smoother because we have very limitation of time.
Please keep your mic off and keep them on only when you want to ask question. Otherwise, you will use
Yes.
live screening.
So I would like to go in fast and brief because I would like to see how is the leg. But this is my common finding after my osteopathic uses. Our both leg discrepancy gets to normal. And I can go for chiropractic, but today I'm not going to go for that. Okay. So again, so the center again here. Can you bend it inside? 1, 2, 3, 4, 5. Okay. Yes. Do it. 1, 2, 3, 4, 5. Okay. Thank you. Please come from here. So now I deband. 1, 2, 3. Turn to that side. Again, I would like to explain about this is above greater trochanter. Hold it. Proximal release. Okay, fine. Come on your back. Both of quadriceps, normal. So for these muscles, above knee would be proximal weight and release, and below knee would be distal weight and release. So I think somebody had a question about hamstring. I'm going to repeat it again here. So proximal weight release, medial hamstring, and then and now at popliteal. Here we can go proximal distal both, medial to lateral. Now for gastrocnemius, this would be distal weight release, distal weight release. Now for tibialis posterior and soleus, this would be again tibialis anterior. Okay, can you just come again on this side? Let me show again one more time. So I'm repeating again. Generally, I cover in the same position. I don't ask my patient to flip flop, but only just to show it to you, I'm gonna do it. Yeah. Mm. 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 Okay. Yeah. Can you show from here? Do plantar flexion. Yes. Yes. So here, patient is performing plantar flexion. I'm just maintaining my pressure. So this movement, my thumbs are sliding up automatically, completely. So can you just slide down again on your tummy? Let me check your leg length again. Here I'm repeating. Check. Patient should be straight in the bed. Sometimes patient is oblique to other side, is not in good position. Yeah. So now, quite some time back, like there was this much gap in this two middle malleolus. Right side was upper. So now when I'm checking it, these are balanced, completely balanced middle malleolus. That means this posture is here. But still I'm going to confirm it with applied kinesiology. Can you bend it? Yes. Can you bend it? Yes. Can you bend it? Yes. Wait. Can you bend it? Yes. I'm finding it really balanced. Both sides I'm finding it strong. As I mentioned about applied kinesiology, if you want to confirm, you could check the weaker side. Where side the weaker, so to go from weak to strong. So how I did my entire session of osteopathic management of lower limb, as I mentioned about, I included myofascial release and LAS is ligamental articular strain, and we checked this balancing. And I'm requesting everybody to perform it on your patients. And this is such a simple technique, but very effective. I'm using it almost 4-5 years, and I'm finding it very much effective. So thank you, everybody, and I would like to happy to answer your 1 minute. Huh? I would like to happy to answer your questions if there is something. Yeah, please.
Sonia, go ahead.
Hello, sir. Good morning. It was a
Good
great
morning.
session. Sir, my question is about applied kinesiology, that is